The coronary circulation is a vital network that supplies the heart muscle with oxygen and nutrients. It is made up of the coronary arteries and veins. There are two coronary arteries which originate from the ascending aorta just above the aortic valve. These are the right and left coronary arteries. The right coronary artery, or RCA, arises from the right coronary sinus. It follows the right atrioventricular groove and gives rise to two major branches: the right marginal artery, which supplies the right ventricle, and the posterior descending artery, or PDA, which supplies the posterior interventricular septum and parts of the ventricles. In summary, the RCA supplies the right atrium and ventricle and provides blood to the sinoatrial node in 60% of individuals. It also supplies the atrioventricular node in 80% of individuals. The left coronary artery, or LCA, arises from the left coronary sinus and quickly splits into two main branches: the left anterior descending artery and the left circumflex artery. The left anterior descending artery, or LAD, travels along the anterior interventricular groove and supplies the anterior wall of the left ventricle, the anterior two-thirds of the interventricular septum, and the apex of the heart. The circumflex artery, or LCX, follows the left atrioventricular groove. It supplies the lateral and posterior walls of the left ventricle and the left atrium. The LCA supplies the left atrium and ventricles and the sinoatrial node in 40% of individuals. In most people, the posterior descending artery is from the right coronary artery, a condition known as right dominant circulation. In left dominant circulation, seen in 10% of people, the left circumflex artery gives rise to the PDA, or the posterior descending artery, while in codominant circulation, which is seen in 20% of individuals, both the RCA and the left circumflex artery contributes to the posterior descending artery. The coronary veins drain deoxygenated blood from the myocardium into the right atrium, primarily through the coronary sinus. The coronary sinus is located in the posterior coronary sulcus. It receives blood from smaller veins, which include the great cardiac vein, which runs alongside the left anterior descending artery, the middle cardiac vein, which runs alongside the posterior descending artery, and the small cardiac vein, which runs alongside the right coronary artery. Other smaller veins include the anterior cardiac vein, which drain directly into the right atrium, and the Tebesian veins, which are microscopic veins that drain directly into the heart chambers.